this is what is shoulder dystocia. The head is delivered, but what you see is the head is retracting in between. And then you can see the baby's head which is facing the earth. It refuses to restitute. Okay. Now this is an emergency, so immediately you have to follow what is known as a helper maneuver. So immediately call for help. The first thing you have to follow another mnemonic known as SOAP. So you'll call the senior staff nurses, you'll call the obstetrician, you'll call the pediatrician, and you'll call the anesthetist. Okay. As soon as help has arrived, you will start doing the procedures. The mnemonic that you follow is the helper mnemonic. First is you evaluate, identify where the back is. Dr. Mahesh, please see where the back is. So here you can see that's important to know where the back is, because only then you will be able to give the suprapubic pressure. Then you should not panic. You ask the patient not to strain, don't give any fundal pressure, and then you have someone to do the documentation, and then you can go ahead with the procedures. The first thing that you do is lift the patient's leg up. Now the legs should be flexed and slightly abducted, and you have to give suprapubic pressure. By this Macrobert's maneuver itself, 90% of all babies might deliver. Along with it, you combine with the Macrobert's suprapubic pressure. This is what has been given. A continuous pressure is given so that the shoulder will get adducted and get pushed to the oblique diameter. That will help in this larger diameter. It will help in dislodging the shoulder, anterior shoulder. If that fails, then you can give intermittent pressure like this. Okay, if this method also, most of them, by 90-95% of all babies will deliver with these two methods. For delivery of the posterior arm, you put your hand inside and then you try to go to the posterior arm. Now you must identify the fingers. Go to the elbow, press with the cubital fossa. The forearm will flex. Catch hold of the forearm and try to sweep the baby's hand across the chest. This is the way you do the forearm. Now the other thing that you can also do is you can apply traction using a finger on the axilla of the posterior. What you can also do is you can apply traction using a finger on the axilla of the posterior arm. That also might help in delivery of the posterior shoulder. In fact, this is one of the very easy methods that you can do to deliver the shoulders. I am going to show you Rubin's tool. For Rubin's tool, you insert your hand from 4 o'clock position. Go to the posterior aspect of the anterior shoulder. And then you just try to gently push the baby to the opposite side. And at all levels, the continuous traction of the baby's head also should be done. So I try to do this. If this fails, then you use your 2 fingers of the other hand and you go to the anterior aspect of the posterior shoulder and you do this corkscrew maneuver. If this also fails, then you remove this hand, you slide this hand in the anterior shoulder, bring it down and do a reverse corkscrew maneuver. In all these maneuvers, you are trying to dislodge the shoulder from the AP diameter and try to bring it to the oblique diameter. Now if this fails, then the only thing that you have to do is put the patient on all fours. By doing this all fours, the baby might slip off. If it doesn't, then you can repeat all the maneuvers again.